Hello, and welcome to the HSJ Health Check Podcast, where each week we explain and debate the most important news issues right now in NHS policy and leadership. I'm Annabelle Collins, and this week I'm joined by podcast regular and deputy editor Dave West and correspondents Jack Serle and Nick Carding. So we've got quite an eclectic array of different topics to discuss today, but we think they're all also linked. First of all, we've got a big estate story that Nick's published this week. It's really interesting. It's focusing on a new construction framework that is set to deliver the 40 new hospitals. So Nick, I'm hoping you can kind of give a little bit of the background behind the story. I'm also kind of interested in the fact the 40 new hospitals are in inverted commas. So if you could kind of talk a little bit about that as well. So what's the story about?
Sure. So I know a lot of stories about frameworks and procurement can be a bit boring or sound dry, but this one I feel is very much the exception. So I'll try and explain why. So obviously everyone's familiar with the government's pledge to build, quote, 40 new hospitals, even though the various plans that have been put in place so far, we don't quite know if there are going to be totally new hospitals or if it's going to be major refurbishments. So obviously the word hospitals is slightly contentious. The way that trusts are going to buy everything they need to get those hospitals built is going to be done through this framework. So it's a really, really important sort of shop window of services that the Department of Health is trying to create. With frameworks, you can sometimes run the risk of perhaps having too many suppliers or too few suppliers, or suppliers who are put on the framework but then aren't able to deliver what they say they will deliver. So it's absolutely key to the whole policy that the DH, when it chooses the suppliers that goes onto this framework, that it gets it right. You don't want to have a situation where you have too many, too few, or where suppliers aren't perhaps compliant with what they were promising they would deliver when they're on the framework. So there's a huge amount of money which is going to be spent through this framework. So the DH is estimating £20 billion of capital funding going through the framework during its 6-year life. And a lot of that will be for the projects linked to the 40 new hospitals. And then there will also be other projects which trusts do on a more sort of regular basis. So it's going to be the main way the NHS buys estate services going forward for the next 6 years. So it's really important that the DH gets it right when it's choosing which suppliers should be on the framework.
Why do they need a new framework now? There clearly has been not a lot, but there has been some building of hospitals in recent years.
So there is an existing framework already run by the DH, and that framework is expiring. It expires in October. I think that one's been running for about 4 or 5 years from memory. And that's been considered a success in terms of the fact that the projects that have been sort of brought through it have been delivered, I think, most of them have been delivered on time. They've spent about, I think, £3.5 billion through that framework. So it's been considered quite a big success. There were only 6 suppliers on that framework. And I think the intention with the new one is that there's going to be maybe more like 6 to 10 per category of projects for this framework. So
that'll sort of stimulate a whole market, I suppose, if they're going to. And it also quite interesting. It seems to have come quite quickly at the beginning of the year in a way.
It has. So I think going back a year, there was a bit of uncertainty about whether or not there would be a new construction framework, or maybe not one straight away. But with the government's making very clear its priority to build these hospitals, clearly health chiefs have felt the need to start straight away. And it was interesting in a webinar that the DH gave to potential suppliers. NHS Improvement's head of estate, Simon Corbyn, said that the heat is on, was the way he put it. He was already feeling the pressure from the new administration to get this sort of capital renaissance up and running again. So yeah, I think from their point of view, they're very keen to just get this started as quickly as possible. But of course, it's a little bit dependent on how soon the capital funding is announced, whether that's going to be in the budget, in the comprehensive spending review.
Yeah.
So
do you have an inkling of when that could be announced? Are you expecting it in the budget?
My gut feeling is no. I think it'll be more likely to be set out in the comprehensive spending review, which is in October?
Later this year, right?
Yeah, well, these varying accounts. One source, reasonably senior source, suggested the other day that there could be a spending review before The summer. I just suspect that autumn to winter is much more likely given any kind of past performance, which does push back. I know the NHS has been able to get on with setting up this framework, obviously, and there's things they can do without having the multi-year capital funding envelope there. But I mean, the longer it pushes back, seems to me it will slow down inevitably various parts of the process.
Yeah, I think it's also just worth bearing in mind that perhaps contrary to the government sort of giving or the Tories giving a sort of an impression that the first 6 hospitals are sort of their plans are ready, and the plans have been fully drawn up and we're now ready to put spades in the ground. It's not really true, because of the first 6 hospitals set to be delivered, none of them have completed their business planning process yet. They've still got to go through a couple of different stages to show that they can access the money. That process is probably going to take at least another 6 months at the very least. I read about Leeds, which is one of them. They're having an open day in a couple of weeks to get potential suppliers in to discuss potential solutions and ways to build things. So clearly some trusts are very much right at the start of the process, but which is a little bit contrary to sort of the impression I think has been created that these plans are ready to go and we're now going to sort of give them money start digging.
And the target's 2030, right?
So it's in 2 tranches. There are 6 big new hospital projects planned to be delivered from now to 2025. And then there are further 21 trusts who have been given a couple of £1 million to draw up plans for big either refurbishments or brand new buildings. And those 21 will expect to start their projects between 2025 and 2030. However, the NHS has Simon Stevens has indicated that, if there's a very good argument for one of the trusts, which is so far planned to do it between 25 and 30, if they want to bring it forward and really need to bring it forward, they can do so potentially. There's some wiggle room, but it is subject to how robust those plans are and what money is available at the time.
Well, what chances do you give of these 6 actually being finished by the time of the next general election, most likely 2024, 25?
I think construction projects always very often take longer than they are supposed to. One example, which I heard about recently, was from Robert Naylor, who was obviously pivotal in the building of the UCLH facility, and that started in the early 2000s. That project is technically still not finished because there is still another phase to go. Obviously, that's a special case because it was a particularly complex one. But I think it's of the 6, I would if I was a betting man, bet that at least 1 or 2 aren't fully opened by the end of
fully. But I mean, would they be open to? I think people would not. People would be perfectly happy if it was actually largely there, as in the case of UCLH, and it's sort of, are they going to be there and taking patients? And
do you think they'd be happy? Because I think this is such a maybe the general public, I don't know, because it's such a seminal policy of Boris Johnson. Is the 40 new hospitals, I feel, has been the most kind of repeated and trailed thing since he became Prime Minister. And if there aren't, well, I mean, we know that there's not going to be 40 new hospitals, but if these, would you describe them as 40 projects? Like, what's a more accurate way of describing them?
It's difficult to say. I mean, I would say at the moment there are 40 potential projects, potential hospitals.
Doesn't sound as good, does it?
Yeah, it's a bit less appealing. But I think it's an interesting point, and it may be something that happens that that you have come 2025. In Leeds, perhaps you've got a hospital which is sort of 85% there, and that means that they can run quite a lot of services from there, but maybe still some services have to be run from their crumbling other facility. And I think that's something which easily surely come election, the opposition could use to say, well, it's not technically open yet. I mean, I know you said some of it's open and all of it. So
yeah, I mean, I agree. They're building up expectations of 40 when the number by the next general election is going to be well short of that, even if they're not, whether they're fully open or not.
Yeah. There's no way there's going to be 40 new ones by the end of this government's term. It's going to be at best 5 or 6.
What about, do you know whether there's is there much in this framework, do we know yet about sort of strict environmental credentials requirements? Because the planning guidance implied that all future NHS building full stop should be net zero carbon, which seems like a big ask.
So at the moment it's been mentioned as an aspiration. So the currently the procurement for this framework hasn't actually launched yet. They're still in the sort of information gathering stage. And in the webinar, Simon Corbyn did mention sustainability and sort of adhering to the carbon neutral targets as being really important. At the moment, I haven't seen anything sort of concrete, but I would expect that definitely to feature because it kind of has to now, doesn't it? It's been given so much sort of exposure and attention that I think it will be definitely a factor, but quite in what shape I don't yet know.
It'll be interesting to see what the suppliers come back with, I suppose.
Yeah, absolutely, yeah. He did also, Simon Corbyn did mention in the webinar that the framework is also going to deliver smart hospitals, but that was all he said.
Intriguing.
And that was intriguing, so that's a sort of phrase I haven't heard much of yet.
It's a sort of technology enabled.
I
mean, there's I suppose the actual building of them and how they're designed and how they're built, the NHS can't avoid a debate at that point about the nature of and shape of services that it wants, because normally, often in recent years where hospitals have been built, it is on certain assumption that they should be there to serve a community-based, and to a degree technology-enabled kind of model of care, and sometimes that ends up with people saying, well, actually we need fewer beds than we expect. Whereas now, over the last year, the narrative of the NHS has changed to say, well, we do actually need these. We do need more hospital beds. However, clearly, it's still keen to try and transform services and have more people able to stay out of hospital, cared for in their homes or communities, and accessing services like outpatients in particular using technology and rather than or in primary care rather than having to come to the hospital. So it isn't a sort of policy or politics neutral process to just build a hospital, actually, is it? It's going
to be very interesting to see when those plans do become more detailed, what kind of designs they're going for and how similar they are. Obviously every trust has got very different sort of situations, so I'm sure there will be variation, but you'd hope there'd be some kind of sort of parallels that they can follow, and that the remaining however many hospitals we end up getting, that they sort of follow some kind of similar structure. But time will tell.
Time will tell. Yes, and as we've said, construction in estates is clearly a priority of this government, but so was prevention. And I remember listening to Matt Hancock's kind of maiden speech when he was when the government won the election in December, and he kind of emphasised that prevention remains a priority of this government. And I think that links nicely to a piece of news this week, which was the publication of the Marmot review. And we had I think we had the update in 2010, and this is 10 years later, and there were some pretty concerning lines in that review. And I don't know if Jack, you can just give us kind of a flavour of what he said.
Well, yeah, I mean, it's pretty stark, but also, dare I say it, not wholly surprising.
No.
So he was commissioned in 2010 or 2009 to produce this sort of review of the social determinants of health and health inequalities, and he's done a 10 years on kind of update. And so the top lines are things like life expectancy is stalled. People in more deprived areas live more years of their life with poor health or with disability than people in less deprived areas. There's a north-south divide. That sort of standard comparator when you look at PHE fingertips on databases, which is people in Blackpool have much worse outcomes than people who live in Woking. Compelling and stark and a challenge to policymakers all bound up in one PDF, but not wholly out of kilter with what we've kind of come to understand and expect when you look at health inequalities. And
how did the Health Secretary respond to the review?
Well, he welcomed Professor Sir Michael Marmot for raising this, as an issue and for highlighting it. Which is interesting given that we've known about this for the last sort of 7 years, but or longer. And people have been talking about the way to address these social determinants is through a sort of multifactorial investment in social care and in preventative policies. Going back to the 70s, people have been writing reports recommending these sorts of things. So perhaps. Dare I say it, somewhat disingenuous, but it's also a bit of a challenge to the Health Secretary, because whilst he's been talking prevention is better than cure, given the sort of ideological bent of the Conservative Party towards sort of liberal with a capital L, personal responsibility, it's quite difficult for him to square the calls on him for policy from public health professionals, which are very much orientated towards sort of investment in things like housing, education, early years, looking after children in their first 5 years of life.
Yeah.
The climate and the environment that people live in, and the impact that has on your health long term, versus the sort of take personal responsibility, which is was sort of ran through the Prevention Green Paper that came out last year. So it's a bit of a tricky situation, because on the one hand you're getting what are ostensibly kind of lefty policies, invest in stuff, and on the other hand you've got the kind of I wouldn't want to go too far to say that people must pull their socks up and do things for themselves, but it's perhaps less willing to be quite so nannying.
What was the Matt Hancock is, I think, instead of keenness on a kind of fiscal tax intervention, tax style of nanny state, he's keen on. Was it personalised kind of prevention? There's a sort of technology enabled style of prevention which Matt Hancock and probably the wider government seems more keen on. As I understand it.
Yeah, it strikes me as kind of like risk stratifying and sort of more targeted interventions towards different sections of society. So the digital component obviously appeals to our health secretary, and I think the not producing blanket policies that affect the entire population. So minimum unit pricing, for example, is unpopular because the argument goes that it's punishing people who consume alcohol in a responsible way, whilst being a bit of a blunt object to tackle problem drinking.
Sounds slightly more ominous to me. If you've got a kind of, the nanny state is first of all going to look up somehow whether you are the one who's going to pursue these unhealthy behaviours and get ill, and then kind of knock on your door digitally or otherwise, and kind of do something about you, rather than it's like more of a nanny state than just putting taxes up a bit, as is already the case with things like cigarettes, etc.
Sort of, as opposed for preaching to the mass, it's a little tap on the shoulder and a rather sort of pointed bit of don't want to eat that. And I think also that the this is, to me, still fairly kind of broad and nebulous genomics component, which is very popular in government as well, which I wouldn't want to be drawn on whether or not it's a viable and sort of in terms of short-term area to produce some interventions and policies. But genomics can often be a bit of a buzzword, so I'm a little wary about that as well.
And I thought the way that the report was kind of written about was quite interesting, because I think austerity has obviously been brought into it, but that's obviously, and austerity itself is a political kind of ideology, I suppose, but actually it's more complicated than just being down to austerity. There are these kind of historical government policies that have I think you tweeted earlier that they've known about since 2014, but not acted upon.
I brought my dossier of stories, which I'm going to wave now for the benefit of our YouTube viewers.
The West Files.
The West Files.
The first story we did related to this published was on late July 2013, which I remember was the day after the birth of Prince George, I believe, because it was on. We managed to get coverage on a sort of a one column on the side of the Times front page next to the kind of image of the sort of proud parents and baby or whatever it was. So maybe outside it was a day or two after the I don't know how quickly the turnaround was, but at which point there a number of people in public health, in particular Danny Dorling, who's a public health professor and again kind of pretty ideological about these things, and Dominic Harrison, who's a public health director in Lancashire, and someone or other in PHE who had started monitoring this in the regional teams of PHE, had sort of been keeping an eye on it. There was kind of at that point it appeared as a surge of deaths among older people. And essentially, I mean, I'm never sure how many people kind of know this, but life expectancy, as which has been grabbing the headlines, is essentially only a measure of who is dying at the moment. So the current life expectancy is not actually how long any of us are very likely to live. It's just a reflection of how people are dying at the current time. And so the fact that people started dying a lot more since 2012, roughly, has resulted in this slowdown in the improvement and in some cases reductions in life expectancy. But it started to become clear in 2013, and then 2014, the Department of Health acknowledged that there had been the first fall in life expectancy since 2003, and falls in life expectancy were very unusual. 2003 was kind of a one-off as well. NHS England was talking about it in 2015, well, talking very quietly, sort of behind the scenes about it in 2015, these deaths and unexplained nature and the fact that it might be linked to economic challenges. But way back to 2013, people involved in public health were saying that this may well be linked to austerity and the various kind of policies and the financial slowdown itself, which obviously has impact on kind of employment and earnings, etc., etc. But to this day, nobody is sure by any stretch of the imagination what is the cause. Probably multiple things, including aspects of austerity. And it seems to me it'd be surprising you could make such cuts to particularly social care and support services which really affect older people, and things like the effect of employment on mental health and stuff. It seems surprising all that could happen without having some effect on mortality. In a way, I mean, you've got to ask, like, austerity for so many public services and the state of housing. The public sector would have to some questions to answer if all those cuts to its budgets weren't making some form of difference to outcomes. But however, there are kind of really big other factors as well. Some of which might not be known, like changes to the way that populations behaved or ate, or things going way back to when they were young. People sort of after the Second World War and things now, coming to be in these much older cohorts. So were there changes in behaviour and lifestyle and the availability of things that change stuff then, and more significantly probably. A slowdown in the improvement in the mortality from cardiovascular disease, which has improved over quite a long period, and particularly there was a lot of improvements during the 2000s in smoking rates, and that sort of thing makes a difference. And it's probably worth saying as well that this slowdown in improvement in life expectancy and growth in mortality rates has happened in a number of developed countries, not in most cases not as sort of severely and clearly as it has in the UK, but in Germany, where austerity hasn't sort of happened in the same way, and some other countries they have seen the similar effect. And I think I can't remember if it's Greece or Spain or Portugal, but somewhere where they've seen absolutely kind of extremely stark austerity, there hasn't been so much of a marked effect. So it is not totally clear what the problem is, and yet the problem has been clear for about 7 years. So I think, coming back to Jack's discussion about the Marmot report, it's kind of it hasn't been able to brought to bear on policy for quite a while now, and there's a pretty complicated question about what it would mean if we were to do something, if we were going to do something about it.
I mean, I was just going to ask, actually, what do we anticipate coming of this report? Because it's such, I feel like we see this quite often, big reports where nothing happens. It's quite depressing. Michael
Marmot seems to be being smeared in Guido Fawkes' blog, I think, it gives a sense of how seriously, which is ridiculous, but it does show that the sort of Marmot approach is perhaps not going to trigger a change in policy. But Jack.
Well, I was going to say, I think that there is an opportunity here for people who have a more campaigning bent to speak to the new raft of Conservative members of Parliament who have, taken over the so-called red wall in communities which are going to be in those, will include wards in those lower deciles of deprivation and income, where these sorts of conversations will have more resonance. And so is there going to be scope for, if not specific targeted policies, then a greater recognition? It's not just going to be reopening railways linking Blythe to the rest of the country. It's going to be thinking about or building hospitals in different parts of the country. It's going to be questions of can government policy be orientated around a more sort of populist element, which would incorporate some of the recommendations of Marmot.
To my shame, I haven't read the review. What were the recommendations, or what were the main bits?
There's quite a few about improving education, improving early years,
early
improving
intervention,
community support, stuff about employment, living wage, a wide range of things, some of which the government is kind of trying to do, some of which are probably sort of things that the government would see as not ideologically in line with what it would do, and it's kind of spending around Sure Start.
Yeah, I was just going to say
schemes.
A few of the recommendations are, particularly the early years intervention, it's a flagship Labour policy. So I don't know whether they could launch something and rebrand it as a Tory policy. But
these are the sorts of things where you can see actually strip away some of the criticism of the past 10 years of government policy and think about how you might be able to overlay sort of conservative attitudes and the government's sort of ambition to level up less well-off parts of the country with some of the more kind of broad-ranging recommendations.
Yeah. Okay, and I think actually we've come to the end of our time this week. So thank you very much for listening. Just a reminder to our listeners that the HSJ Health Check is available every Friday morning on hsj.co.uk and across all the main podcast channels. And please do subscribe as well. Thank you very much for listening, and we'll see you next week.